So let's talk about Medicare eligibility criteria for home health. So under Medicare, and I'm sure you're familiar with this if you've been working in home care for a few months, but for us to bill Medicare, there has to be 5 components that have to be met for the patient to be eligible to get the care in their home. And a physician must certify that there has to be a need for home health, and he will establish, or he or she will establish the plan of care and signing it and dating it. And that's called your certification. Some people call it certification, some people call it an order, plan of care, but the doctor has to agree that these 5 components are met. And usually if you look at your orders, when they come out, you would see those 5 things listed in a little box, and the physician would sign underneath it. So the areas that have to be met, the patient has to be confined to home. And I'm sure you hear that more in the terms of the patient's homebound. They have to have the care of a physician or be under the care of a non-physician practitioner, which could be a physician assistant, a nurse practitioner. And then the beneficiary is under a plan of care established and reviewed by the doctor. So once the clinician sees the patient and they talked about the goals of care and what they're going to do, the clinician speaks with the physician, and then they establish what the care plan is going to be, and the doctor will sign that. Then, of course, you have to have skilled services in there. There has to be a need, a medical necessity need for one of the disciplines. Skilled nursing care is on an intermittent basis, and we'll talk about this in more detail in one of the later modules. I think it's module 4. But basically, intermittent means it's not consistent. It's not daily. It's every kind of once in a while. So Medicare up front is saying they're not going to pay for daily nursing visits forever. They don't pay for chronic care. The other disciplines that are skilled are physical therapy, speech pathology, and a continued need for occupational therapy. What that means is Medicare doesn't allow an occupational therapist to make the first visit at home, establish eligibility, write the orders, do the OASIS, but rather if a nurse, let's say a patient had a stroke and the nurse and occupational therapist were seeing the patient, the nurse would have to open the record, do the admission visit, do the OASIS, and the occupational therapist would be seeing the patient. And then if the nurse discharged the patient, then the occupational therapy could continue. That's what it means by a continued need. They could stay in there for 30, 60, 90, how many days, as long as the patient meets those other 5 criteria on this slide. And then the face-to-face encounter requirement basically is, it's a relatively new regulation. I've been in home care since 1983. So when I say a regulation is new, it's probably 8 or 10 years old. But we're going to go into detail in the next few slides. We're going to go into detail about each one of these in the next few slides. But if that plan of care is not dated, then your agency cannot send the claims, so they won't get payment. So that really is an issue for a lot of agencies.